Some nice weather coming. But let's go ahead and switch gears here. As I mentioned, we'll hear from Dr. Lynn from Kaiser Permanente Northwest. Being here with us, and I want to start off, if you wouldn't mind, could we get a definition of what AFib is? I've certainly heard the term, a lot of people are, but maybe you aren't familiar with exactly what that is.
Absolutely. Thanks for having me on as well. Atrial fibrillation is a diagnosis that is an electrical diagnosis that explains where the top chamber of the heart, rather beating in sync with the bottom chamber, is in electrical chaos. So rather than your heart beating top and bottom, the top chamber is fluttering, which can cause symptoms and is the leading cause of stroke as a result because blood can't move effectively through the heart.
And what would cause that to happen?
Typically, we've traditionally thought of atrial fibrillation as a disease of aging. We know that in older studies that it was most commonly found as you get older. It's a chronic progressive condition as a result of long-standing risk factors, things like untreated blood pressure. But what we're increasingly finding is that younger patients are coming to us with this diagnosis before the age of 60, between 40 and 60, for example.
And typically this would be something that is in an older population?
Traditionally has been an older population, but now we're seeing that this diagnosis appear in much younger folks as well.
And so are there any leading causes or factors that are causing this to happen in younger and younger people?
Absolutely. No, we know that there are clear risk factors associated with developing atrial fibrillation. And I think what explains the rise in the general population is because of those shared risk factors. Things like treating high blood pressure, maintaining a healthy weight, staying physically active, alcohol in moderation. We know that those things are really powerful things that can increase the risk of having atrial fibrillation. And by addressing those risk factors can dramatically reduce the lifetime risk of developing AFib as well.
So because of those risk factors, it seems that that's causing this to happen in younger people. And then you mentioned that this can lead to strokes. Can you talk about that connection there?
Absolutely. It is the leading cause of why someone might have a stroke. And the physiological basis is because the top chamber of the heart is not beating in a synchronous fashion. Blood can pool. And that's the way we generally think of as the mechanism for how a clot might form inside the heart that then goes to the brain to cause a stroke. And so early detection through symptoms and digital health tools, things like the Apple Watch or Fitbit or cardio kind of devices, if you can get a diagnosis of AFib at an early age, that might be an opportunity, depending on risk factors, to intervene to help treat AFib itself, but also to reduce that lifetime risk of stroke.
Talking about that, using technology to help diagnose some of that early, you mentioned, an Apple Watch or something along those lines. Can you talk about how that can be beneficial in notifying someone that there is an issue?
Absolutely. We know that not everybody with AFib can have symptoms from AFib. Typically you might feel heart fluttering or racing heart sensation. Some people might have dizziness or lightheadedness, or even just a generalized sense of fatigue or shortness of breath trying to do things. But we also know that there's a large segment of the population that may not have symptoms related to AFib at all. And wearing a watch that proactively monitors for irregular heartbeats can be the clue that we need to do more digging. Another common tool that you might be able to do at home, even without access to one of these tools, is just learning how to feel your pulse. And if you can find your pulse and find that it's irregular, that could prompt further screening with your physician with an EKG or a heart monitor that we could order as well.
Interesting. So just checking your pulse, is there something specific you should look for when you're doing that?
What we're looking for is primarily the irregularity, and a lot of things can cause an irregular pulse, but especially with AFib, it would be sustained irregular pulse, and that would be the clue that we should do more digging to figure out what's causing that irregular pulse and see whether it's AFib.
So thinking of things here for somebody at home, just to kind of recap some of the things that you just mentioned, what are some key things people can or should be doing at home to monitor themselves to see if there might be a potential issue?
Well, I think if you have symptoms, things like a racing heart or skipped beat or lightheadedness or dizziness spells, those should obviously be reasons you should reach out to your physician, get screened for a rhythm issue. But if you're thinking about long-term, how do I maintain my health and reduce my long-term risk of stroke or developing AFib, it's really focusing on those key things like maintaining a healthy weight, avoiding physical inactivity, alcohol in moderation, and diagnosing and treating hypertension or blood pressure issues.
There is something else I wanted to ask too, noted on a study, is that drinking or having cold drinks or eating cold food on hot days can cause some concerns or issues. Can you tell us
That
about that
that was
study?
a nice, really fun study that looked at a group of folks in the Kaiser Permanente system who were diagnosed with AFib or came to the emergency department with AFib and looked for triggers. And not everybody can clearly identify a trigger for what might cause them to go into AFib. This one was specifically looking at whether cold drink intake or cold drink intake with physical activity, aggressive physical activity, could trigger, and did find that quite a high percentage were caused by cold drink intake. So if that's you, if you can clearly associate high cold drink intake with an episode of AFib, then that might be an easy solution for things to avoid.
Interesting. What is it about that that could cause that?
Well, we don't necessarily know, but the
Gotcha.
purported mechanism might be related to uh, the esophagus itself. We know that the digestive tract is closely related to the brain and gut, have this vagal system that could also influence how the heart behaves electrically.
So just kind of monitor yourself, I guess, if you do, you
Knowing
know.
yourself, being in tune with your body, and identifying triggers are easy ways that you could help reduce your burden of AFib.
All right, Doctor. Anything else that you think is important for people to know?
No, thank you for having me. I think that the key take-home message is overall, we know that early diagnosis of AFib can really make a big difference in how it's treated. It's a chronic progressive condition, and the earlier that we can identify it, then the earlier we can offer help. And key take-home messages would be living a healthy lifestyle, maintaining a healthy weight, staying active, alcohol in moderation, and treating high blood pressure and diabetes are really key factors in treating this condition.
All right. Well, thank you very much for your time today.
Thanks for having me.
All right, so good advice there for everybody just on AFib. But I mean, I've got to be honest, I wasn't entirely sure how that all worked. Let's go here, though, to our live look from this camera, from a Maryhill camera. You got a jet flying over, you got a barge coming down the river, and some blue skies. So kind of everything happening right there on the Vancouver waterfront, including some people out there taking a look over the water. And we are here in the Fox 12 Oregon studio, or in the newsroom, actually, and this is the Fox 12 Now studio that you see behind me. And we're going to be live here throughout the afternoon. We are going to take a break, though. We'll be back around 2 o'clock. We'll be speaking to Amzi about the upcoming blood moon, the lunar eclipse, what that means for everybody and how you can watch it, what the best ways to do so are. So we'll have Jim Todd from Amzi to give us some good advice on that. And then throughout the afternoon, we'll have several other interviews. And if there's breaking news, we'll be here for you with that as well. So thanks for watching us, whether you're watching on the website or the Fox 12 Oregon apps, whatever platform you're on. Thanks for doing so. Don't forget that we do have those apps for Roku, for Fire TV, for Apple TV, so plenty of places that you can find this show and everything else that we do here at Fox 12 Oregon. But we'll take a break for right now, and I will talk to you soon. I'm Greg Nibbler. This is Fox 12 Now.